Good morning. Welcome. Thank you all so much for inviting me to present our project. This is a student capstone, and a capstone for nursing students is a little bit like
If everyone could please mute their microphones.
A capstone project is essentially a quality improvement project mixed with a nursing thesis. So the whole point of it is to address a certain population and try to improve the experience, hopefully improve health equity and close a gap that has been identified. And we really wanted to expand that resource accessibility. And don't worry, I will be showing the final webpage at the end, so you all will get a little bit of a taste of what we came up with. So this was an evolving project that has been worked on for quite some time with various students. And our team members included the Rush web content and digital strategy team members. I don't know if any were able to make it here today, but they were essential in helping us understand how to design a web page. Both my partner and I have background in our former careers in marketing and the corporate space. So at least we had that toolkit on background on our side. But we don't make web pages. We're in nursing school. So we really, really relied on them and to make a really beautiful, comprehensive, usable web page for our population. We also worked with human resources, and our goal, well, we'll get to that. So originally, some students and this same team, including Dr. Ailey, created, that was launched just last year, an accessibility resources and services webpage. And this site was really great in a lot of ways. But my partner and myself and Dr. Ailey, we saw an opportunity here to continue pushing this webpage forward. Because the Russians website that they had developed for this patient population um, had a couple of issues that we wanted to work through. It was more of a web page to describe when you visit a hospital, here are some of the resources you might need. Parking, it's near this CTA line. Did you know that we have wheelchair service, masking, service animals, parking vouchers, that kind of thing? All really great and essential to know when you visit an institution. But where we thought it could really expand further is with advertising all of the clinical resources that Rush had specifically for clients with physical, sensory, intellectual, and developmental disabilities, as well as their support people, because it's not necessarily the patient themselves that is doing the research and looking up their calendar to make an appointment. Sometimes it's their support person, a caregiver, or someone assisting them. So we really wanted to maybe focus on more of the clinical side of things. But in order to advertise those relevant resources, we realized that we really needed to get together with the disability community itself. And that's what Dr. Ailey was talking at the top with her introduction, is I am not a member of the disability community. And so what I thought they might need might not necessarily be what they think that they need. And we wanted to be very careful that we weren't limiting what we were advertising to people with disabilities about Rush has. A disability isn't a pathology, and it isn't necessarily that like every single person with a disability needs to see an endocrinologist or a cardiovascular specialist. But there are, just like any other member of a population, they might need to see a provider, and they want to meet with someone who can accommodate, understand, and listen to them. And we can get that feedback from something like the Advocate Advisory Committee, which we will go through with our little process here. So why is this so important, and why were we so focused on developing further this web page? Well, patients with disabilities, they face disproportionate barriers to healthcare access, and this results in more negative health outcomes. So we really wanted to try to close that gap. And people with disabilities experience more positive outcomes when they're able to be involved and empowered in their own care. And this is for everybody, but with someone with a disability, if they want to research a doctor, research an institution, see what that institution has to offer, we want to be able to give them that easily accessible information. And we were hoping the Disability Plus Care webpage could do that. Finally, on the provider side, physicians who have confidence in working with the disability community just provide better care. So we wanted to see if maybe we could make a connection with physicians at Rush who have confidence and passion with working with the disability community and connect them to those patients. And we really wanted web users to be able to really intuitively navigate and understand and interact with the website that was made for them. It couldn't have any additional barriers. So that was our issue that we wanted to expand upon. And so we set out to create we were calling it a one-stop shop, a new Disability Plus Care companion webpage to all the good parking stuff and navigating stuff to address these clinical issues. And our goal was to make healthcare access easier for people with disabilities by developing a very user-friendly, comprehensive page that would cross-link with our accessibility resources and services page. It now includes vetted content, very useful clinical resources, and a list of providers specializing in disability care. So our goals was to create this new Disability Care Plus. Oops, sorry, I'm having trouble zooming in. Oh, it does not want to do that. Here we go. So here were some of our objectives. We wanted the new disability care webpage to be accessible to those with disabilities. This is very fundamental. When you are accessing a web page, you should be able to use your apps if you have a visual disability for it to connect and be able to read that information to you, that kind of thing. So we really wanted to make sure that it met baseline web accessibility standards. We also wanted it to be culturally appropriate and relevant to the disability community. What I think might be relevant to someone accessing the Disability Plus Care webpage might just be an assumption, or it might not be the priority. So we really needed that validation. And finally, and this came out directly from getting that validation. Our third objective, based on feedback from the disability community, was to feature kind of a starter list of Rush providers who have confidence treating people with disabilities. So those were our three objectives. And here's how we went about implementing it. We did not want to throw the baby out with the bathwater. We wanted to use this great webpage that was already developed, this accessibility resources and services, and expand upon it. And as part of that, we really wanted to rely on our microsystem, our group working on this webpage, on their expertise and connections. So when it came time to figure out a list of providers to include, I did research. We checked with Dr. Ailey about her list of people. We worked with our content and web team to ask them, who do you know? So we wanted to utilize what we already have because this, very low budget shoestring, really trying to make this as good as we can using what we have. And finally, to make sure we were moving in the right direction, because otherwise this would be a waste of time and not helpful to anyone, is we wanted to gather that advice, that critique, that feedback from the Advocate Advisory Committee. So this is a little bit about how we implemented this process. Basically, we aligned with the group to review the accessibility resources and services page. We talked with Dr. Ailey about what she was hoping to progress forward with. And then we just kind of highlighted everything that we thought might be useful as a talking point with the community meeting. And we met with them for the first time before we drafted any content, because we realized as we were attempting to draft webpage content that we weren't sure if we were doing it right. And so we were like, you know what? Let's put that off. Let's talk to people and see what they had to say. And they were very, very vocal and had some great feedback for us. So we used all of that information from that committee meeting and drafted the Disability Plus Care webpage for them to review again. And in the second meeting, perhaps because they were a little more familiar with us and familiar with the Rush web pages, we got even more feedback from them. Very, very candid, very specific, very actionable kind of critiques that we were able to incorporate in the final webpage copy. So some of that feedback was they really wanted us to promote the curbside wheelchair service Rush offers. We thought that it was just enough that we said that it was wheelchair service, but they were like, talk to us more about that. This is very important to us. And so we were able to really expand upon that on the other webpage, on our resources page. And when we were talking about providers, which ended up being a huge point and a huge priority, they said that they wanted providers that they could really kind of interact with, which meant they wanted to see provider videos. At Rush and a lot of institutions, healthcare providers, doctors will do a little introduction video, talk about their background, their specialty, stuff that's important to them. And what that really helps a patient do, a prospective client do, is kind of see if this could be a good match for this. Is this someone who's going to listen to me? Is this someone who is going to help, coordinate my care? Because a lot of patients can't just go to one doctor at one institution. They have to go to Rush for one instance, and then they have to go to another outpatient clinic in Oak Park. There's just a lot of coordination there, and they want someone who can really be the captain of the ship in their healthcare experience. The other thing they really emphasize is not just having providers and the videos, which we all then vetted together to find providers who are very relevant and passionate about working with this community, is we wanted to make sure that they came from diverse backgrounds and specialties. That we wanted to make, and this was especially tricky for finding providers who focused on adult patient care. We found a lot of great providers who provided pediatric care, but we wanted to find providers who could specialize in adult patient care and come from a variety of specialties. Maybe they specialize in intellectual disabilities, maybe they specialize in seizure disorders, all that kind of stuff. So a variety of specialties and from diverse backgrounds. And as an addendum to that, let's make it easy for them with these clinical resources. Have that patient intake form readily available on the webpage. Have someone there that they can send an email to and ask questions about before they come in for their appointment. And something that we're really hoping to expand upon, we did a little bit of this, is they really wanted a patient navigator hub. Find a doctor, call about this, where's my intake form, special questions, that kind of thing. So that was the main community feedback. And we incorporated that into our Disability Plus Care webpage draft. And we researched providers, we used our network, and we secured a short list of providers to feature on the webpage. So we created this presentation before the webpage was posted. So I'll show that to you after this poster presentation. And then, of course, I invite questions from you as well. But these are some little snapshots of what we hope to include in the Disability Plus Care webpage. Oh, no, this Disability Plus Care webpage was inspired by the already existing Rush LGBTQ plus care webpage. And we thought that this was a great analogous population. There's also, of course, some, patients that overlap with this community as well. But what we liked about this LGBTQ plus care webpage is that it was everything comprehensive about treating a patient from the LGBTQ plus community. And so this was our exemplar design. And we wanted to include all of the resources Rush had. We wanted to emphasize service animals and that those are allowed at Rush. And then here are some of the provider videos, just some screenshots that we were able to find of providers that seemed like a really good fit for our webpage. So how did we do? This is how we did our outcomes and evaluation. So remember our 3 goals: to create that Disability Care Plus webpage and have it be accessible, that it was appropriate and relevant to the disability community, and that we would have Rush providers, at least a short list, something to begin with, and we hope to expand on the webpage itself. So I'll just note a few of these things. For accuracy, we boosted the web page's compliance with accessibility standards from about 75% to 100%, making it easier for almost everyone to use. We updated old programs. We made sure that wording was correct. We updated images and so on. For comprehensiveness, it was about at 50%, and then we were able to improve it to 75%. And that was purely through adding those clinical resources and that provider information. But there is still an opportunity to continue to progress and expand on this page. In terms of accessibility, we talked about the accuracy and the accessibility. With the vetting of the content, it was previously at, I would say maybe 10% as opposed to 0%. We did have, some feedback, but it wasn't as organized as before. And so we were able to now have 100% community validation on the content. It has all been vetted by the disability community, ensuring that it truly meets the community's needs. Finally, for providers featured, we didn't have any because there weren't any clinical resources presented on the original page. And we had now 6 providers included. And we really hope to expand that list further. I was going through and researching providers and watching all of their videos, but I know we have lots of great providers at Rush that we can add on. So that would be a great spot for growing this webpage. Now for care coordination, that's another thing we can really expand on. We don't have a care coordinator team working behind this webpage. We do have a couple of people who are able to help a little bit. It would be really nice to have a committee or a very specific care coordination team that is able to have like a generalized email or phone number and help. That is going to be in the future. But we did add that new patient intake form for triaging, and we do want to consider those patient navigators in future. We presented the new webpage, and overall feedback has been very positive. I was a little surprised by this, but community members did say that Rush could potentially be a trailblazer in accessibility to peer institutions. There aren't a lot of web pages like this out there. There should be a lot more. So we are hoping to set an example, even if it's an evolving one, of what institutions can do to really provide the best care possible to their patients with disabilities. And I think this project really underscores the importance of working so closely with the community itself to make sure that digital resources remain up to date and accessible. Again, it's very, very basic, but with time constraints, other projects becoming a priority, budget commitment, all that kind of thing, it can be really easy for a web page to become out of date pretty quickly. I already mentioned that we really want to expand that Find a Doctor section with even more providers. And looking ahead, we really recommend maintaining active involvement with the community advocates to keep the content evolving, relevant, and to continue meeting the needs of individuals with disabilities. We just launched the Disability Plus Care webpage this year. I believe, when did we launch it? I want to say in August of this year. So we do not yet have web analytics to measure like success from that standpoint of this webpage. We're hoping to do that coming up. But what would be really amazing is to launch internal, external promotions of pages to reach even more members of the disability community. And we would love to systemize a kind of criteria to get more feedback from patients about how their experience was at Rush with these providers. And without further ado, I am going to show you our Disability Plus Care webpage. So this is a little bit about our mission statement from Rush right here. Rush provides safe, comprehensive, and inclusive care for people with physical, intellectual, neurological, sensory, and developmental disabilities. Now we have this section of all the clinical resources. Let's go to Find a Doctor. These are some that you can search using keywords about what you might need. Find a location, make an appointment. Then this links to the original accessibility and resources and services page. You know, if you want to come in, how do you get parking, service animals, interpreter and captioning services, which are very robust at Rush. Oops. Here is our patient intake form. So you can do that very easily directly from the website. Here is more about our mission statement and all of the various facilities and departments that are relevant. And then this is kind of our, you know, our little jewel in the crown is our Disability Plus Care providers. So we have some, and they all have videos. So you can, a patient can be introduced to these providers. So these are some family care providers, some rehab physicians. And of course, we would love to expand upon that. And we will. And then here are the videos that we kind of spotlight here. And we did, and we're hoping that as this grows and gets more use, that we might have some testimonials. So here is one from Marty right down here. And then at the bottom, of course, we have our hub for finding a doctor, find a location and making an appointment. All right, so that's our Disability Plus Care webpage. I open the floor to thoughts, comments, and questions.